I'd like to talk about how, as a trust, we hold the needs of our adolescents and young people in mind, no matter where they touch down in the trust, whether it's in our children's department or anywhere else, so that all of our staff across the trust feel confident at supporting our young people. I think for me, why it matters is that we know that young people today face really significant challenges, far more so since COVID. We know that our cohort of young people and adolescents face really big challenges with mental health, with navigating the world around them and keeping themselves safe. So for adolescents, some of them are facing changes in family circumstances, lots of challenges and pressure within education. For some of them, they're entering their first relationships and sort of thinking about how they manage and navigate those. For some of them, they are managing complex and ever-changing friendship dynamics. We also know that there are lots of risks in our modern society with social media, with increased availability of substances. And so I think, having a workforce that's psychologically informed and feels really confident to better understand all of these different domains and challenges is actually really important in how we meet young people's needs. I think I want to highlight the importance of actually spending time and good quality time in conversation with young people when they come into our services, when they come into our departments. And getting to know them, getting a sense of what's going on for them. And I think it can be quite daunting as a clinician to hold all of those things in your mind. One of the things that we have available that was developed a number of years ago, it's used really widely across a number of trusts, is the HEADS assessment tool. So this is a really nice, semi-structured kind of conversational tool. And it lists a number of domains as well as prompt questions. It's not intended to be used as a tick box exercise. It's really intended to be used to try and open up conversation with a young person. So it's a really useful tool that takes you through a number of domains, which helps us pull out not just what makes a young person confident and strong, but if there are any worries, concerns or risks where we may need to document and we may need to bring in the advocacy and support of other services. My take-home message would be to familiarise yourself with the HEADS tool. I think it's known to increase confidence in talking to young people. It's a really robust tool. As for where you can find it, if you go onto the intranet and type in PSN, which stands for Psychological Services Network, you will come to our department's page, click on Paediatric Psychology, and there will be a link to the HEADS assessment tool.